Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist, and today I'll talk to you about esophageal cancers. What exactly is the esophagus? Now, esophagus is that part of the gut which connects the mouth to the stomach. So it's a tube, and like cancers can happen anywhere in the body, it can happen in the esophagus. So, how exactly do patients with esophageal cancers present? The typical patient is an elderly gentleman who complains of difficulty in swallowing. So, it's an elderly gentleman, and most of the time, the typical complaint is what we call dysphagia or difficulty in swallowing. The patient will tell the doctor that the food is getting stuck when he is eating, and sometimes he has to consume water to gulp it down. And it is progressive, that means it keeps getting worse. So, initially, it may be for liquids, and gradually, it will be for solids. And if nothing is done, patients may move to total dysphagia or they'll not be able to swallow anything. So, this is the typical presentation of a patient with esophageal cancer. But not all patients will have this typical presentation. We are seeing it in younger patients. Some patients do not have dysphagia. Some others have other symptoms. They have pain while swallowing, a symptom we call as odynophagia. And then some other patients present directly with advanced cancer. When the food does not go down, it regurgitates into the lungs and produces what we call as aspiration. In very advanced cases, we may have patient vomiting blood out or hematemesis. So these are the common symptoms of esophageal cancer. Now, what exactly causes the patient to develop esophageal cancer, and how common is this cancer? Now, there is a lot of variation in the geographical distribution of esophageal cancer. In South India, especially in regions of Karnataka and Tamil Nadu, esophageal cancer is one of the more common cancers. Unfortunately for us, it's a very aggressive cancer and very often leads to a lot of disability and death. What are the risk factors for esophageal cancer? Now, to go into this, we have to know that there are different types of esophageal cancer. One common type is the squamous carcinoma, and the other is adenocarcinoma. The esophagus is divided into three portions: the upper, mid, and lower portion. While squamous carcinoma is more common in the upper and mid portion of the esophagus, adenocarcinoma is more common in the lower third of the esophagus, in the part adjoining the stomach. The risk factors for esophageal cancer would be mainly smoking. Very often we find that patients of carcinoma esophagus would have smoked or would be former smokers. Alcohol consumption is also a common risk factor for esophageal cancer. One very important thing to realize about esophageal risk factor is reflux disease. Reflux is a very common problem in the population, and very frequently we have people complaining of reflux after taking food. Does reflux disease lead to developing cancer? It certainly is a risk factor, though it may not happen in majority of the patients. What exactly happens during reflux is that the part where the esophagus joins the stomach, there is a sphincter or a valve which prevents reflux of the stomach contents into the esophagus. In reflux disease, very often this sphincter is defective, leading on to stomach contents regurgitating into the esophagus. This chronic irritation causes changes in the inner lining or the mucosa of the esophagus. When these changes are severe, we call it a condition known as Barrett's esophagus. And this can lead on to the development of cancer. So, though not all reflexes lead on to develop cancer, it certainly is a risk factor. So, what are the tests that are done when the doctor suspects carcinoma esophagus? The most important test which is done is an endoscopy. Here, this is usually done by a gastroenterologist. A tube is with the light is inserted into the mouth to see if there is a growth. And if there is a growth, then the next thing to do would be to take biopsies, to take small pieces which are sent to the pathologist, and the pathologist examines under a microscope and comes to a conclusion whether this is a cancer or not. And if it is a cancer, what type of cancer it is. Now, the diagnosis alone is not sufficient to treat. We have to stage the disease. We have to see how much it has spread. For this, we do various tests. Commonly, we do a CT scan. Sometimes we do a more advanced test known as the PET scan. So, summarizing, esophageal cancer is a fairly common cancer in South India and in and around. The most common symptom is dysphagia, especially in an elderly male who is also a smoker. So, any patient, elderly patient who has the progressive dysphagia, worsening of this thing, needs to get it evaluated by meeting an appropriate doctor and get an endoscopy done, and if necessary, a CT scan done. Thank you.